ప్రణతి
సార్
వినిపిస్తుందా?
వినిపిస్తుంది సార్.
సార్ రండి సార్, ఎగ్జామ్ అదే మన ఆఫీస్ రండి సార్, ప్రిన్సిపల్ సార్ ఆఫీస్ రండి సార్. మీకు లింక్ పంపించాను సార్. హలో సార్, వచ్చారా సార్? మా ప్రణతి
సార్
ఫ్లైయర్ ఓపెన్ అయిందా?
ఓపెన్ అయింది సార్.
ఓకే, ఇప్పుడు నువ్వు చదివేటప్పుడు ఇక్కడ మేము మారుస్తూ ఉంటాం.
సరే సార్.
ఓకే
అయ్యా నాకు చెప్పు షెడ్యూల్ ఎవరెవరు ఏందో.
నేను చెప్తాను.
ఫస్ట్ లింక్ పంపుతారా?
మీకు వాట్సాప్ చేశాను సార్ లింక్.
మన కాలేజ్
just by staying at our home. Okay, then staff, student, researchers, innovators, leaders, entrepreneurs, dreamers, never give up, never abandon your aspirations or inclinations, whatever it may be. And during this pandemic period, and always will strive for better tomorrow. Honorable management members of Vignan Group of Institutions and the Vignan Pharmacy College, respected principal Professor P. Srinivas Babu garu, convener, the chief guest Dr. P. Narayana sir, President of LPA Mumbai. He is so positive, vivacious, and so supportive. And Dr. Rajeshwar sir, IPA AP State Branch President, co-convener, Professor Prasad Rao sir, and organizing secretary, Ashok, revered speakers, dear participants, and faculty members, the students. Once again, welcome to you all to this webinar. On this occasion, I am going to be thanking first organization for providing resources in explicit technology and infrastructure facilities in materializing such programs. All the speakers in this webinar, are just assiduous guys. Like Professor Rajeshwar is a very eminent professor. Everybody knows that. Nagarjuna, and Koteswar Rao, Dr. Krishna Chaitanya, Sobha Madam, and Dr. Abdul Pasha. Everybody knows him also. Dr. Sunita from Hindu College of Pharmacy. In fact, they are going to exploring different sorts of topics. I hope these topics will help you a lot. So while you are watching this presentation, please take down the important points that come up as you watch these presentations. Eventually, you will learn lots of things that you don't know. So I hope these topics will help you a lot. Finally, I strongly believe that time is the most precious resource we have, and you prefer to spend your time with us, your educational time with us, as a right. It's not welcome. Really, in order to achieve success, three things are necessary. First, you must want to succeed. You must learn how to succeed. Third, you must go on attempting till the success is yours. You can't get any success unless you work hard. Okay, be cautious of COVID-19. Stay strong, stay safe. So, over to Pranati. Sorry.
Thank you, sir. Thank you very much.
Thank you,
Over
sir.
to Pranati.
Thank you, sir. Thank you, Ashok sir and Ravshankar sir, for your valuable words.
Yeah, thanks a lot.
A lamp doesn't speak. It introduces itself through its light. Now let us all have virtual lamp lightening ceremony. Namaste, Parabhrahma, Janardana, Parabhrahma, Janardana, Diko Hartu me Papa, Sandhyadika Namostute. Brahmarupastham Jyotisham Prabhuravyayam Brahmarupastham Jyotisham Prabhuravyayam Arogyam Devi Putrausha Atim Swachhami Me Sada Yaverastam Samarabhya Yavat Suryodayam Bhavet Yaverastam Samarabhya Yavat Suryodaya Bhavet Yasya Dishte Gruhe Deepa Tasya Nasti Darindrata Shubham Kurutvam Kalyanam Arogyam Dhana Sampada Shubham Kurutvam Kalyanam Arogyam Dhana Sampada Shatru Buddhi Vinashaya Deepajyotir Namostute Deepajyotir Namostute Shubham Kurutvam Kalyanam Arogyam Dhana Sampada Shubham Kurutvam Kalyanam Arogyam Dhana Sampada. Now, I am privileged to invite Dr. P. Srinivas Babu Garu, convener of the event, Principal, Vignan Pharmacy College, and Vice President, IPA AP State Branch, to address the participants. Sir, please.
Thank you, Pranati. Good morning to all the participants, panelists, and our today renowned speaker, my Guru, Professor Rajeshwar Rao Garu, President, IPA, AP State Branch. I, Dr. P. Srinivas Babu, Principal and Vice President of IPA AP State Branch, Guntur. Hearty welcome to all the participants and speakers for this 1 week student enhancement program on role of pharmacy teachers, a holistic approach to create an end product of education, be a free creative man. In association with IPA AP State Branch, first organizatory show and analysis for this program. Hello. Yes, sir. Okay. So I first I would like to thank our chairman, Sir Dr. Lau Rattay Garu, and Sri Krishna Devarayal Garu, Vice Chairman of Vignan Group of Institutions, and our chief guest, Dr. My Guru and Dr. TV Narayan Garu, President, IPA Mumbai, and also Director, Vikas Institute of Pharmaceutical Sciences, Rajahmundry, and all the conveners, Dr. Rajeshwar Rao Garu, President, IPA State Branch, co-convener, Dr. Prasad Rao, Ma'am College of Pharmacy, Secretary, IPAP State Branch, and all the panelists for accepting our invitation and making this program a grand future success. So I today, on behalf of Vignan Pharmacy College, we all welcome you for this 1 week program. And today's speaker, Dr. Rajesh Rao Garu, having a vast experience in the pharmacy field. Sir having the uh, B Farm from Andhra University, M Farm, pharmacology, and PhD, and he sir has guided so many students, and he worked in various administrative posts, and foreign collaborations and international conferences. So, with a vast experience, sir, today one of the first speaker for this inaugural program. On behalf of Vignan Pharmacy, we are very thankful to you, sir, and especially our chief guest, Dr. T.V. Narayan Garu. Without his support, we can't start this program and do these things. And on behalf of Ignan Pharmacy, we have done so many IP activities, and this is first of its kind with AP State Branch with Honorable Rajesh Rao Garu sir guidance. We are doing this program to benefit the students. So I hope this session will give a good information to all the participants and as well as the various students. And this information will be recorded, and you can go through it whenever the students need the information in the YouTube. So I am on behalf of all our college faculty and all the students. We are very thankful, and I request the Pranati to hand over the session.
Thank you, sir, for your wonderful words. I feel it a great honor to invite Dr. P. Rajeshwar Rao Garu, Principal, Lydia College of Pharmacy, President, IPA AP State Branch, to please speak few words. Sir, please.
Thank you, Pranati. It is a nice thing to be with you today. And within few days, the program is scheduled and the title is given. And accordingly, the team of Vixion acted and arranged everything for running 1 week program to enrich, create innovative, inspirable knowledge in the minds of budding pharmacy people. They may be B Farm, undergraduate, pharmacy course and D Farm. And especially this is arranged with respect to undergraduate courses. And the main theme of this particular program is what? When I talk with Dr. Nageswara, principal, and he said, this is the thing we have to conduct, sir. And immediately we chalked out, and the program is arranged in this way. The title is given, The Role of Pharmacy Teachers, a holistic approach to create an end product of education, be a free, creative man. Say, my dear teachers of various colleges and Vigyan College of Pharmacy and elsewhere in India who are watching this particular program, teachers are the gurus, but there are two types of teachers are there. One set of teachers who teach the subject to the student as such what that is there to understand the knowledge related with the textbook. And another set of teachers are there. Those teachers who dissipated subject at the same time they inspire the inside fire of the students in order to be created a creative status in them. So such sort of students many times and sometimes spark and they lead the society. For example, our Abdul Kalam, he is a creative man. He got his education through teachers only. But the teachers who taught him ignited his creativity, thereby what? He is able to reach to that level and fulfill the wishes of the gurus and serve the nation in a very huge way. So that type of teachers and students are helpful to the community and to the society for progress and good living, to carry good living lifestyle, thereby what? Health and wealth of the society will be good and everybody will feel good. So the main motto of education is to inculcate knowledge in the disciples of respective discipline, and thereafter ignite the fire in them to become a free creative man. Here the word free creative man, what it embodied innovation and inspiration. Those two things are responsible for the creativity. So thereby, through his knowledge, he creates. For example, in the New Zealand, without having a copper wire, through certain electromagnetic waves itself and stations, a current transmission can be made. Thereby, that technology, if it comes out, definitely it will be a boon to the remote areas, thereby what? Even in any hill station, power supply can be given, thereby that area will flourish and develop. That type of thing is a creativity. And if a engineer is there, a metallurgy man, if he creates a metal with least weight and with high strength, which can be very much useful in the aeroplanes, thereby the strength of its cover will be improved. At the same time, the weight carrying capacity of the flight also increases. And thereby economy, see, by making that fuel consumption, the same fuel consumption, more passengers are more weight. So the cost decline will be there. Thereby a good services can be attained. I hope now you people might have incited the meaning of the free creative man, thereby what? The teachers of pharmacy, it is related with the drug industry. So new drugs are very much wanted and they are invited because of their toxicities. No drug is free of toxicity. If a drug is free of toxicity, that is not at all a drug. So, in order to calm down the toxicities that are arising with a particular molecule, if a better lead or a candidate identified definitely that is a very good invitation to the health industry. And that is a good invitation to the patient community. Thereby, what the sufferings that they are having after treatment, they will not be there, so that their homeostatic conditions before disease will again attain. So in this way, today I am going to give a overview on drug discovery and development and use of animals in the drug discovery, then its implication in the drug discovery program, and what type of animals are to be used. And majority of your teachers, they do not know and even not seen some of the animals specific for a particular examination of a disease. And on that, the talk will be there. In my talk, after telecasting this thing, a brief introduction will be there, because without having a good sound understanding on the topic, if you people will listen, that is a mere waste. First, the critical things that are required in the program, that is to be understood. You have to spare some time, and thereafter through PPT presentation, I will explain regarding that program, today's program. Thank you. Srinivas Babu, Ravi Kumar, Ashok, and other persons who are involved in this particular program, for giving me this opportunity to address the students today. And I am handing over the mic to you, and next I will come in the program.
Thank you, sir. Thank you very much, sir.
Thank you, sir, for
What
your
about
wonderful
Pranati?
work.
The sound system should be proper,
Okay.
because there should not be any break. If break is there, the sound engineer must be there, and he should do control. Otherwise, the total program will be waste, mere waste.
Okay, sir.
Thank you, sir, for your wonderful words.
Thank you.
Now let us enter into our first session by Dr. P. Rajeshwar Rao, sir, on the topic Animals, Experimental Pharmacology and its role in drug discovery and development. I am honored to read out the profile of Dr. P. Rajeshwar Rao Garu. He pursued his graduation, post-graduation and PhD from Andhra University and worked as assistant professor, associate professor and professor in Andhra University from 1985 to 2017. He have 1 year industrial experience as manufacturing chemist in Vico Pharma Private Limited. He worked as chairman, board of studies, placement officer, AU College of Pharmaceutical Sciences, and assistant principal, AU College of Pharmaceutical Sciences. He received State Teacher Award 2014 from Government of Andhra Pradesh. He is a coordinator in pharmaceutical sciences for the coursework conducted in collaboration with Alcorn State University, USA, sponsored by MHIRT. As a resource person, he attended many international conferences, workshops, and seminars. He completed many projects, and his papers are published in international journals and also presented at various conferences. He guided many MPharm, MSc, and about 24 PhD students for their thesis. At present, Dr. P. Rajeshwar Rao Garu is working as Principal, Lydia College of Pharmacy, Ravulapalam, and he is also President, IPA AP State Branch. Sir, we are honored that you are present here today, and the session is yours, sir.
Thank you, Pranati.
Sir,
Yes.
sir, you can share this
షేర్ చేస్తాను.
Yes.
ఏంటంటేనేమో అలా నా ఫస్ట్ ఇది ఉంటుంది మాట పీపీటీ.
Okay, sir.
ఆ బ్యాక్గ్రౌండ్ లోనే నేను లెక్చర్ ఇస్తూ ఉంటాను కొంత.
Okay, sir.
బ్రీఫింగ్ ఆ తర్వాత నేనే స్టార్ట్ చేస్తాను.
Okay, sir. Okay.
అలా ఉండిపోయిందని గాబరా పడవలసిన నెసెసిటీ లేదు.
Okay, sir. Sure, sir. Thank you, sir.
So it is clear. PPT is on the screen.
Yes, sir. Yes, sir.
Okay. So very good morning, my dear teaching community, students, scholars. A very good morning to you all. I am delighted to be with you people today on a topic, animals, experimental pharmacology, its role in drug discovery and development. A wonderful time for me, I feel. And before going to discuss on various aspects of this, I will tell you how the drug discovery is actually taking place. Say, drug discovery is a complex process involved several discipline subject experts in the form of a groups involved and discussed about the disease condition, why a drug is needed. Simultaneously, mostly the private sector or the government sector, both are involved. Government support may be there, or without government support, private sector may involve in this particular process. Thereby, lot of expenditure is incurred on this particular program. And lot of money will be expended on this program. So, very, very critical, super critical way, examination by many groups. It is a multidisciplinary, how our pharmacy is having multidisciplinary subjects in our core syllabi. Similarly, multidisciplinary personals will involve in this particular project and they give their outputs, and based on the outputs, this drug development team will screen, scan and evaluate, and finally they chalk out a program and they recruit several knowledgeable persons in that particular field. Then they proceed for the development of drug. So in this particular thing, what? Biochemistry people will be there, pathophysiologists will be there, medicine people will be there, chemistry people will be there, pharmacy people will be there. Like many disciplines will involve. A disease is to be identified first. For example, ischemic heart disease. That is nowadays the second ranking death rate in globe is what? The ischemic heart diseases and heart diseases. So a proper drug is to be identified and reasons are to be identified. Sometimes the drugs that were already discovered may be causing a lot of adverse reactions on long-term administration. Thereby what? A safe and better drug is required, and in such way, and good market is there. Once it occurs and continuous treatment is required, commerce is completely involved in it. Thereby what? people are very much interested to develop drugs, and whatever the amount of say spend that may be on that project, they never mind and they go on working for that particular thing. So this will be there. If it is an ischemic heart disease, and the reasons for that, what type of drug that is to be given. And it is ischemic heart diseases are due to narrowing of the coronary arteries, and the reasons may be high lipid content, lipid profile may be excess. So what is to that extent how a particular secondary disease promotes the ischemic heart disease? If a comorbidity is there, diabetes, how a diabetes is actually responsible for the development of ischemic disease, heart disease, or congestive heart disease. So many things may happen, thereby what? Clubbing all these factors and relevant scientists' expertization and their assessment, everything will be taken into consideration, and the disease pattern, biochemistry, and pathological sequences also will be established. Then only the targets will be decided. When the targets are decided, that is the before drug discovery, this particular on a particular thing, this work will be carried out by the industry. And now, when they come to a conclusion, that will come forward, and then chemistry people will come, and combinatorial drug discovery, that is what the virtual screening and in silico screening, and this sort of methods and their results, everything will be taken into consideration. They will be filed, and finally analysis will be made, and targets will be identified. Based on the targets, the drug discovery will start. Now, earlier, not like that. And due to the advent of high throughputs, the discovery time actually lessened, shortened. In old days, it may be taking several, it is also several years, on problem. So now that work will be started as soon as they identify a molecule, and that molecule will be given to the pharmacokinetic division, where total biopharmaceutics of that particular subject, how it is metabolized, what are the metabolic pathways, everything will be revealed. And simultaneously, the toxicology group, another group, very important group in the drug discovery, they will take that particular molecule, and those toxicology group people, they will work on the toxicity of this particular molecule. They will conduct acute toxicity, subacute toxicity, and chronic toxicity type studies, and what are the possible toxicities that are there. Then who is the candidate to do all these things? Shall we go forward for purpose? I think nobody will come out. బతికుంటే బలసా తినొచ్చు అని అనుకుంటారు అన్నమాట. So here the animals are actually coming forward to sacrifice their life for the good. See, that is the animals' representations towards the human kindness. See, in that way, animals are playing a major role in the drug discovery. Without animal testing, no drug will come out. And so many things, in the topic we are going to discuss. So animals play a key role, and here variety of animals are there and several disease conditions are there, and for each disease condition a particular program is to be carried out, and particular selection of an animal is responsible, thereby what lifespan is also very important. For example, anti-diabetic drugs that we are taking, and it is a lifetime drug. Antihypertensive drug, it is also a lifetime drug. And in this way, main program will, I will come to the main program. In this way, what we have to think about the consequences that are going to be developed, and a better drug is to be evolved, and thereby what discovery is a continuous program, and drugs are discovered. And now I will start the actual insight that is there in this program. Oh, right. Now we are pharmacy professionals, and we are having certain role to play in the health, and thereby the role of pharmacy professionals, what the quality of medicine supplied to patients is a big role. How we are supplying, what type of quality medicines that we are supplying.
సార్ హలో ఏం పేరేంది
ప్రొఫెసర్ రాజేష్.
రాజేశ్వర గారు ఇంకేమైంది నెట్ పోయిందండి డిస్కనెక్ట్ అయ్యాడండి ఒకసారి సార్ కాల్ చేయి
ఎస్. ఓకే, నో ప్రాబ్లం సార్. మీరు షేర్ చేసేటప్పుడు పైన అక్కడ డిజేబుల్డ్ పార్టిసిపెంట్స్ ఉంటుంది సార్, డిజేబుల్ చేయండి, యానిమేషన్స్ ఉంటుంది పైన.
లేకపోతే ఒక నిమిషం
ఒక నిమిషం సార్, మేము చేస్తాం. ఒక నిమిషం, అదే ఇక్కడికి యానిమేషన్. ఓకే,
ఎనేబుల్ అంటుంది.
నో ప్రాబ్లం సార్. ఇప్పుడు ఏంటంటే ఎస్ సార్, ప్లే అవుతుంది సార్. కాకపోతే ఏంటంటే మనకి యానిమేషన్స్ మీరు డిజేబుల్ మీకు డిజేబుల్ అండి. ఓకే సార్, మీరు స్టార్ట్ సార్. అదే సార్, డిజేబుల్ చేయాలి మీకు. మీరు అన్మ్యూట్ చేసుకోండి సార్, మీరు అన్మ్యూట్ యువర్సెల్ఫ్ సార్.
మనీ రేట్ అంటే
సార్ అన్మ్యూట్ చేసుకోరా మీరు ఒకసారి. మీరు అన్మ్యూట్ మీకు ఆప్షన్. ఓకే సార్.
ఓకే సార్, audible sir?
Yeah, it is very clear.
Thank you,
okay
sir.
sir,
Thank
you share sir.
నేను మాట్లాడొచ్చా?
Yes, sir.
Yes, sir.
Yes, can I come? Can I start?
Yes, sir. Yes, sir.
Okay. So the advising the patient's work is carried out by the pharmacy students presently, and other role is what? Advise other healthcare professionals about safe and effective medicines use. That is also the role of pharmacy professional. Provide services to the patients, for example, smoking cessation, cholesterol management, blood pressure measurement. So smoking is responsible for the lipid profile alteration, and that lipid profile alteration may cause development of atherosclerosis, arteriosclerosis. The arteriosclerosis or atherosclerosis may be responsible for the development of ischemic heart diseases. So it is one way or other way, like diabetes is also responsible for the development of cardiac myopathy or ischemic heart disease. So they are interlinked. One disease influence will be there on the other system, thereby here certain bad habits definitely alters the lifestyle of the people. Thereby, if they follow good way of living, definitely there will not be any problem. Smoking cessation, cholesterol management, blood pressure measurement, and why pressure is to be regulated. Otherwise, what will happen? A stroke may develop or ischemic heart disease may develop. And these are the problems. We have to educate them how to, they have to follow or regular exercise to maintain the normal blood pressure or to be active, and cessation, how it will help in reducing the blood pressure and revert back the ill health condition to the normal health. This sort of things we have to educate, and mostly the pharmacy as well as the pharmacy students can do this particular subject. Supervise production, preparation of medicine, and also the quality of medicine. And it is purely carried by the B pharmacy students, because rather than the communal oriented pharmacy course. Thereby, those people are involved in the preparation of drugs, quality drugs and quality medicine supply, and they they follow certain norms. According to the norms, quality drugs will be prepared. So that particular division is another division where mostly the B Farm students are
Rajesh, sir.
carrying
Sorry for the
those
disturbance.
jobs. So that is also the people, yes, where the
Sir,
people
share
are
చేశారు.
involved in.
సార్ స్క్రీన్ షేర్ చేశారా సార్? మీకు ఇచ్చాను సార్, మీరు షేర్ చేయాలి.
నేను షేర్
అవ్వలేదు సార్ మీరు. సార్
నా షేర్ అవ్వట్లేదు. ఇదిగో సంగీత, నా స్క్రీన్ షేర్ అవ్వలేదు, షేర్ చేయాలి.
మేడం షేర్ చేసి మోర్లోకి వెళ్ళి మీరు డిజేబుల్ చేయండి మేడం, యానిమేషన్స్ డిజేబుల్ చేయండి రా.
ఓకే షూర్.
షేర్ స్క్రీన్కి వెళ్ళి పైన మోర్లోకి వెళ్ళి మేడం.
ఓకే
ఎస్ మ్యామ్. యా,
ఇప్పుడు షేర్ అయింది.
నా ఓకే మ్యామ్.
ఓకే
ఎస్ సార్. మేడం డిజేబుల్ చేశారా మేడం మోర్లోకి వెళ్ళి పైన?
దట్ డిసేబుల్ పార్టిసిపెంట్స్
యానిమేషన్
ఫైన్.
అది క్లిక్ చేయండి మేడం.
యా క్లిక్ చేశాను, వచ్చిందా?
ఎస్ మ్యామ్, ఈజ్ ఓకే నౌ.
అయితే
సార్ ఇక్కడ కంటిన్యూ సార్. సారీ ఫర్
చెప్పింది స్క్రీన్ మీదకి రాలేదు మాట. డజంట్ మ్యాటర్. అది యా, ఇది స్క్రీన్ మీదకి ఇంతకు ముందు రాలేదు నేను చెప్తునేటప్పుడు.
ఓకే సార్.
ఓకే. Okay, now,
Thank you, sir.
yes,
Thank you
yes.
very much.
Now I'm continuing. So the earlier mentioned things are a role of pharmacy professionals. And now let us come. Why therapy is required? Why drugs are to be discovered? And therapy is required because we are getting several diseases and sufferings. And for those to alleviate, a certain treatment is required. In the allopathic medicine, chemicals are being used, and thereby through them what we can suppress the disease condition or we can cure the disease condition. So that is why a therapy is required. For example, influenza is there, therapy is required. Tuberculosis is there, therapy is required. And why drugs are to be discovered? Because drugs are chemical in nature. My dear students, your body is nothing but the combination of carbon, hydrogen, oxygen, sulfur, phosphorus, even fluoride. Many things are there. And many metallic things are also there. Zinc, cobalt, nickel, strontium. Many things are there. And they are all obtained when the evolution of our system developed by taking the material from the surroundings. Thereby all are involved in this, and through that what gradually it developed, now we are. And copper is there in us. Copper is required every day for the promotion of hemophysis. Vitamin B12 is also required for the promotion of hemophysis. Less than 1 microgram is required. Zinc is required for improving the metabolic activity. Calcium is required for many reactions as a second messenger and also for strengthening the bone. So in such a way, they are all there. They are known things to us. Thereby, such sort of things, when they are entering, our body will not respond in a different way. If it is excess, they will be cleared from the body. But when chemicals are coming, a sulfur drug or an anti-cancer drug, whatever it may be, it is foreign to the body. And when it is foreign, naturally, body doesn't like it and it will try to send it out. But during this particular time period, it may interact with several pockets that are present in our body, thereby alter the various metabolic pathways or damage the particular DNA component or RNA component. Ultimately, the enzymes that are responsible to be participated and followed in a certain enzymatic metabolic reactions, they will be altered. A disease pattern may further, another disease may develop. This sort of things are going to happen. So drugs are there. Drugs may be using if the toxicity is too severe on long-term administration, months together or years together, then there is no other option, a discovery of a better molecule to be discovered. So drugs are to be discovered because due to their secondary effects, if a good molecule comes, the patient feel good. To have feel good, drug discovery must be there. And before that what? I told you everything is present in our cell, how the things are happening. How things are happening, and let us examine. What is disease? A disease is an abnormal condition affecting the body of an organism and associated with specific symptom and signs. So the symptom and signs, they are giving an indication that he is having certain disease or something else. Even COVID, the taste bud losing their taste, temperature rise. Thereafter, in the lungs, angiotensin converting enzyme 2 will be affected. Thereby, the architecture of lung is completely damaged when this particular thing entering into the inside the cell and creating nuisance where the cytokine burst or thunder resulted in the death of the subjects. So, a disease is an abnormal condition affecting the body of an organism and associated with specific symptom and sign. Next, if we see the cell, how it is actually there and how the things are happening. Now you see the video. Now you see the video.
Cells are the smallest living units of an organism. All cells have three things in common, no matter what type of cell they are. All cells have a cell membrane, which separates the inside of the cell from its environment, cytoplasm, which is a jelly-like fluid, and DNA, which is the cell's genetic material. There are two broad categories of cells. The first category is eukaryotic cells. They have organelles, which include the nucleus and other special parts. Eukaryotic cells are more advanced, complex cells, such as those found in plants and animals. The second category is prokaryotic cells. They don't have a nucleus or membrane-enclosed organelles. They do have genetic material, but it's not contained within a nucleus. Prokaryotic cells are always one-celled or unicellular organisms, such as bacteria. So what are organelles? Organelle means little organ. Organelles are the specialized parts of a cell that have unique jobs to perform. Let's start with the nucleus, the control center of the cell. The nucleus contains DNA, or genetic material. DNA dictates what the cell is going to do and how it's going to do it. Chromatin is the tangled, spread out form of DNA found inside the nuclear membrane. When a cell is ready to divide, DNA condenses into structures known as chromosomes. The nucleus also contains a nucleolus, which is a structure where ribosomes are made. After ribosomes leave the nucleus, they will have the important job of synthesizing or making proteins. Outside the nucleus, the ribosomes and the rest of the organelles float around in cytoplasm, which is the jelly-like substance. Ribosomes may wander freely within the cytoplasm or attach to the endoplasmic reticulum, sometimes abbreviated as ER. There are two types of ER. Rough ER has ribosomes attached to it, and smooth ER doesn't have ribosomes attached to it. The endoplasmic reticulum is a membrane-enclosed passageway for transporting materials, such as the proteins synthesized by ribosomes. Proteins and other materials emerge from the endoplasmic reticulum in small vesicles, where the Golgi apparatus, sometimes called the Golgi body, receives them. As proteins move through the Golgi body, they're customized into forms that the cell can use. The Golgi body does this by folding the proteins into usable shapes, or adding other materials onto them, such as lipids or carbohydrates. Vacuoles are sac-like structures that store different materials. Here in this plant cell, the central vacuole stores water. Going back to an organelle called a lysosome. Lysosomes are the garbage collectors that take in damaged or worn out cell parts. They are filled with enzymes that break down this cellular debris. The mitochondrion is an organelle that is the powerhouse for both animal and plant cells. During a process called cellular respiration, the mitochondria make ATP molecules that provide the energy for all of the cell's activities. Cells that need more energy have more mitochondria. Meanwhile, the cell maintains its shape through a cytoskeleton. The cytoskeleton includes the thread-like microfilaments, which are made of protein, and microtubules, which are thin, hollow tubes. Some organisms, such as plants, that are photoautotrophic, meaning they capture sunlight for energy, have cells with an organelle called a chloroplast. The chloroplast is where photosynthesis happens. It's green because it has a green pigment called chlorophyll. Plant cells also have a cell wall outside of their cell membranes that shape, support, and protect the plant cell. Animal cells never have a cell wall. There are many other unique structures that only some cells have. Here are just a few. In humans, for example, the respiratory tract is lined with cells that have cilia. These are microscopic hair-like projections that can move in waves. This feature helps trap inhaled particles in the air and expels them when you cough. Another unique feature in some cells is flagella. Some bacteria have flagella. A flagellum is like a little tail that can help a cell move or propel itself. The only human cell that has a flagellum is a sperm cell. In summary, remember, eukaryotic cells are plant and animal cells with a nucleus and membrane-enclosed organelles, while prokaryotic cells are unicellular organisms without these things. All cells have a cell membrane, cytoplasm, and genetic material. And even though only plant cells have chloroplasts, both plant and animal cells have mitochondria.
Yes, now you people know about the cell, what are the organelles that are present, what are the job that is carried out by those organelles. And if you compare, see our universe having planets and stars, how they are balanced and doing their regular rotation work, and day and night comes due to this this circulation, this circling of Earth around the sun. And similarly, the cell you observed, it is also having several structures how a universe is possessing. And that means what? Our body is having a different forms of cells, and again each cell is having a small subcellular universal model in it. Under normal conditions and good watering condition, with all elements and nutritive values when available, all cells are functioning and there is no question about a disease. Because the immunity system will be very strong in them. Thereby what? Those soldiers themselves attack whenever an invading organism or a foreign particle that comes, they damage in, and thereby what? Neutralize the toxin effect. In that way, a comparability is existing between a universe and a cell, and all our cells functioning in that particular fashion and doing their duties. For example, stomach, digestion; lungs, respiration; heart, pumping; kidney, filtering. Like each functional organ having a special property cells with it, and those property cells are working to the full extent for that purpose, thereby a healthy human volunteer. Now you are listening and understanding, and all these things are happening means what? Your system is good. When you are moving this side or thinking a other side or something inside the brain, though your presence is there, that means what? There is some mistake or disturbance in your system. And this is the experimental study. Animals, we are first animals that we are adding. Why animals are required? Because ischemic heart disease model, this is developed in our laboratory. Even scientists from CCMB also came to my laboratory. They learned this technique by staying in my lab for a week or more. And this is the experimental study on ischemic heart disease. Here the heart rate of the rat is more than 350 to 450 per minute. And in this particular thing, what? Just how the thoracotomy, cardiotomy, pleurotomy, how this tracheotomy, how these things will be carried out in heart surgery. Similarly, we also do thoracotomy and tracheotomy and pericardiotomy. Then we will identify the heart and the blood vessels, ascending and descending coronary arteries, and to the descending coronary artery at one particular branch, we ligate the coronary artery at the finding the particular area at risk. And we stop supply of blood to that particular area for a period of 30 minutes. Thereafter, we release the knot, and then reperfusion in that particular artery will be there. In the non-circulatory area, blood goes. During this time, what? The rush of oxygen in that area, which was earlier under hypoxic condition, immediately receives oxygen, and during this particular process, a free radicals more generated, and those radicals themselves damages us. That is why in heart surgery, we are not getting 100% this thing. Due to this reperfusion injury, some activity is actually, development is blunt by free radicals, and thereby a partial benefit only the humans they are getting. And on a particular subject, we carried out this particular experimental design, and we worked out on it, and it was published in American journals. Even it is texted in one chapter in artery bypass book that is published in America. And see, now what is disease that we are discussing? Say this is a one condition, elephantiasis. This is due to this parasite. And for this also drug treatment is required. Really it is pathetic. Only drug, diethyl carbamazine citrate is there. Now still till date also that is the main drug, and secondary drugs are also developed. Next. And this is diabetic retinopathy. You can see on the screen that normal retina, how that is, how the blood vessels and macula, how that appears. And in retinopathy, and the blood vessels damage is you can see, and thereby ischemia, aneurysm will be there, hemorrhage may be there, and thereby what? The disturbance in the vision takes place. And see, in the retinopathic site, the image will appear like that, and in the normal eye, the normal vision appears like that. So diseases are, many forms of diseases are there, pathophysiology is there, and biochemistry is there. Based on the pathophysiology and biochemical reactions that are going on and biochemistry, the targets will be found out, and based on that what drug discovery will carry out. And this is diabetic foot ulcer. And due to the glycolation of proteins, and the immunity is very much affected, and in that even a small wound may develop as a foot ulcer there. And recovery will be sometimes very difficult in them. Sometimes ganglia may develop. We have to take out that particular part. And gouty arthritis. They are all diseases. Even diabetes affect the kidney, and kidney damage may take place. And similarly, diabetes may cause cardiac myopathy. See, if you observe the normal heart, the ventricle of the left ventricle is very thick, right ventricle is thin, and ventricles are normal, and thereby in each stroke 70 ml of blood is going to the lungs as well as to the aorta. But whereas in the cardiac myopathy, that is in the diabetes, these contraction coupling elements are maximum damaged, and thereby heart develops hypertrophy in order to keep circulation rate normal. For that what? The length of the myofibrils is to be increased, thereby the heart itself, by using another mechanism, renin-angiotensin mechanism, proliferation of these myosin fibers, elements, contractile elements, length increases. As per the Starling's law, when the length is increases, force development also will be. The heart, damaged heart, thinks that in that sense, it increases the size of the heart in order to maintain the normal cardiac output. But over a period, when it is losing its elasticity, it becomes failing, and then thereafter the cardiac output will be dropped, and finally the individual will die. So diabetes is responsible for the cardiac damage. So that is a debate. The pathological development of various disease forms, if you see, one example to understand in what way the drug discovery is going on. Now you see, observe. And this is the ischemic heart disease condition, how it develops. Say this is the artery, coronary artery, and this is the left descending artery. This side is the right descending artery. In the left descending artery, in one particular branch, due to the atherosclerosis, see the normal atherosclerotic cells, the atherosclerosis, these epithelial cells are normal. First, you observe normal epithelial cells lining is there. When this fat deposition and other things are happening, the fatty streaks, calcification, plaque formation takes place. When blood touches the hard surface, immediately thrombus formation results, and finally narrowing of the artery take place, and finally it may occlude completely. The narrowing also sometimes low amount of blood flow and high work put on the heart muscle resulted in ischemia, and finally if it is not corrected, ischemic patch will develop and infarction develops, and when infarction size increases, ejection fraction alters. When ejection fraction follows less than 30, then cardiac arrest may take place. So in this way, what things are happening, and here diabetes may be one reason, or hypertension may be one reason, or lipid profile may be another reason. All these diseases are responsible for the development of ischemic heart disease. No. Now, another disease pattern. Now, why I am showing all this thing is what? How a drug discovery program is taken into consideration. In the earlier case, the drug discovery program is taken into consideration based on the pathology that is there. And in this form is what? Peptic ulcers. Peptic ulcers. In the peptic ulcers, what are the targets in order to reduce the peptic ulcers? And a therapy can be started to treat the peptic ulcer disease. And let us see this particular
Hydrochloric acid is
video.
produced in
Follow this
parietal
video.
cells through a complex series of reactions. Carbon dioxide diffuses into the parietal cell, and the enzyme carbonic anhydrase catalyzes a reaction between the carbon dioxide and water to form carbonic acid. Carbonic acid dissociates into bicarbonate ion and hydrogen ion, and the bicarbonate ion is transported back into the bloodstream. An ion exchange molecule in the plasma membrane exchanges bicarbonate going out for chloride coming in. The hydrogen ions are actively transported into the duct of the gastric gland, and the negatively charged chloride ions diffuse with the positively charged hydrogen ions. Potassium ions are counter-transported into the parietal cell in exchange for hydrogen ions. The net result is production of hydrochloric acid in the parietal cells and its secretion into the duct of the gastric gland.
So produced, if the acid mechanisms are overacted, acid production will increase, thereby what? It may cause duodenal ulcers, peptic ulcers, epigastric ulcers, like many forms of ulcers may develop. And the targets for its what? If you see that hydrogen ion movement, that is the final common pathway. Potassium hydrogen ion exchange will be there, and that is one site. And the other sites in the parietal cell are what? H2 receptors. One site. And in the enterochromaffin cells, M1 cells are there where histamine is stored, and when vagal stimulation is there, acetylcholine is released, M1 receptor activated, and thereby histamine is released. Histamine acts on H2 receptors. It activates adenyl cyclase, and cyclic AMP levels are increased, and protein kinase system is activated. Finally, resulted in the activation of potassium hydrogen pump. Through that what? Acid production is taking place. Then that is one target. M1 receptor is another target. But in the duodenum, just when chyma is going inside, in that particular area, these hormones are released. That is the gastrin. Gastrin again acts on the parietal cell where the gastrin receptors are present, responsible for the release of calcium. I told you, calcium is also a second messenger. This calcium activates the protein kinase system, and that pathway is one way where acid production increases. And acetylcholine also present. These receptors are present on parietal cells. They are M3 type of parietal cells. So through that mediated mechanism in the cephalic phase, through that mediated mechanism, acetylcholine releases, and these M3 receptors are activated, inositol triphosphate and diacyl glycerol, and that activates the protein kinase system. Thereby what? Hydrogen potassium activation takes place, and hydrochloric acid is generated. When bicarbonate ions are decreased and mucus secretion decreased, there is every chance to interact acid with internal structure, and that resulted in the development of acid. So in this particular disease, and as a drug discovery personnel, and targets are identified, and now what type of drug is to be developed, and based on that what drug discovery system will carry out, and a proper experimentation prior to human trials, they should be conducted in animals. So without any animal experimentation, no drug will come into the market. I think now it is clear, and disease pattern study is very much important. I have given one example to understand, and acid production peptic ulcers model I have given. Now you know how drug discovery based on the disease condition, how it will be continue the program. See, in our laboratory, we tested by gastric ligation, pyloric ligation, and we found that, and we had some plant extracts. When we studied, you see that peptic ulcers, how they developed on the antral region of the stomach. Reddening is there, more reddening. When we have given a plant extract, it inhibited that particular thing. And you people, and this is how pharmacology, what the pharmacology that we know, actually these pioneers of pharmacology responsible for the promotion and growth of our pharmacology and development of experimental pharmacology and pharmacology as a separate branch took place, and given a meaning that how a drug action takes place, overall idea understanding, preliminary and proof also they made, thereby what promotion of pharmacology taken place very shortly after their discoveries. This Claude Bernard is a French pharmacologist, and he observed how this arrow poison is actually making animal to immobile, and he found that the curare is responsible for neuromuscular blocking, thereby the animal becomes inactive and it is not able to run or walk. And the other person is Rudolf Buckiam, and he is a German pharmacologist, and he discovered the bioassays. And Oswald Schimmelberg, he isolated adrenaline, histamine, second time adrenaline and histamine, and several amino acids, and he is also a German pharmacologist. And John Jacob Abel, another person, he is a father of American pharmacology. He given the status of pharmacology, and he wrote book also. John Jacob Abel, he contributed a lot in his country. And here this gentleman, Ramnath Chopra from India, he is the instrumental in the development of Central Drug Laboratory, CDRI. CDRI, under his stewardship, it is developed, and now it is a area where a discovery can be made easy. And this gentleman worked on herbal drugs, and in his commemoration, our postal department, to remember him, they released a stamp also. So these are the stalwarts who involved in the development of pharmacology to bring the pharmacology in the form of a subject. And now, till now, we have seen that disease pattern and the scientists who are involved in the development of pharmacology. And further, I told you many times, animals are very important in the drug discovery. Without animal experimentation, drugs cannot be come out into the market. And here, if you observe all these findings by using animals, you will come to know that yes, animals are very important in the drug discovery. Important medical advances achieved through animal research. In 1796, vaccine for smallpox developed in cow. In 1881, vaccine for anthrax developed in sheep. In 1885, vaccine for rabies developed in dog and rabbit. In 1905, pathogenesis of tuberculosis found in cow and sheep. In 1919, mechanism of immunity elucidated in guinea pig and rabbit. In 1921, insulin discovered in dog. See what we know about insulin today, that was discovered in 1921, and the animal responsible for that is what? Dog. In 1928, pathogenesis of typhus discovered in guinea pig, rat and monkey. In 1932, function of neuron discovered in cat and dog. The function of neuron, you know, excitability and conductivity is the function of neuron. In 1942, the RH factor discovered in monkey, rhesus monkey. So that is why rhesus monkey's factor, that is the RH factor discovered in monkey. In 1943, vitamin K discovered in rat, dog, mouse. In 1945, penicillin tested in mouse. In 1954, polio vaccine developed in mouse and monkey. In 1956, open heart surgery and cardiac pacemaker developed in dog. See, what the surgeries that is going on in hospital today, that is the information given by the sacrificing personalities. Here the animals, dog is responsible for that open heart surgery and cardiac pacemaker developed in dog. Later on, the exercise made more and experience gained more, and later in humans it is carried out. In 1964, regulation of cholesterol discovered, rat. In 1968, rubella vaccine developed in monkey. In 1970, lithium approved, rat, guinea pig. In 1979, interaction between tumor virus and genetic material discovered in monkey and mouse. If we say, oh, a lot of animals are being used in the discovery of many things. 1984, monoclonal antibodies developed in mouse. In 1990, organ transplantation technique advanced in dog. See what the organ transplantation technique used for liver transplantation or kidney transplantation. In 1990, organ transplantation technique advanced in dog. In 1995, gene transfer for cystic fibrosis developed mouse, non-rodents and human primates. In 1997, prion discovered and characterized in hamster and mouse. In 1998, nitric oxide as a signaling molecule in cardiovascular system discovered in rabbit. We know that the L-arginine, acetylcholine, if you give, blood pressure will come down. How it come down? This nitric oxide development only. And that increases the cyclic ZMP, thereby dephosphorylation takes place in the actin and myosin interaction and resulted in relaxation of the vascular smooth muscle bed and blood pressure drops. So nitric oxide signaling mechanism is discovered in rabbit. Brain signaling transduction discovered in mouse, rat. 2002, mechanism of cell death discovered in worm. 2003, non-invasive imaging method, MRI, for medical diagnosis developed in rat. 2004, organ receptors and the organization of the olfactory system discovered in mouse. See, in every discovery, animal is taking the main role. And later on, they are extended to the human beings or to understand the pathology, whatever it may be. In this way, animals are the things which gives the sufficient knowledge on the disease pattern, thereby what gives a scope for the discovery of drugs. And it also helps in identifying the targets for the discovery of drugs. See, animals are very much needed. And now we know in the discovery of drugs, and majority are given through oral system only drugs are, it is better all the time to administer drugs through oral system only. When it is not possible, the physicochemical factors of the drug molecule, if it is not in a position to absorb through our system, then only the other form of formulations will be developed. And sometimes the first pass metabolism may be there. In those cases, through other means also it can be administered, and formulation development will take place in those direction. And now for your understanding how that dissolution, first pass metabolism, bioavailability, how the bioequivalence to understand, I am playing this particular video. Please watch.
After swallowing an aspirin tablet, it will go on a journey through your digestive system. Absorption. The tablet will travel down the esophagus into the stomach, where it is dissolved into much smaller particles. These particles will continue their journey into the small intestine, where most of them will be absorbed into the blood. The small intestine walls, also called lumen, are lined with tiny villi which stick out to provide a large surface area for the nutrients inside the food to be absorbed. Looking closer at these villi, you can see they have a rich blood supply and they are covered in a thin layer of epithelial cells. The aspirin molecules will work their way through the epithelial cells and into the bloodstream, where they are carried around the body. Distribution. Blood plasma contains complex molecules called albumin. Albumin is a protein made by the liver which transports nutrients around the body. Albumin also binds to drugs that enter the bloodstream. Here you can see some of the aspirin molecules binding to the albumin. All the aspirin particles that have been bound will be filtered out as they pass through the liver, and only the remaining aspirin molecules will get through and have any effect on the body. Different drugs will bind to albumin in different amounts depending on their affinity for plasma protein. The next stop on the journey is the liver. The aspirin-rich blood will enter the liver through the hepatic portal vein at the bottom, and it will exit at the top via the hepatic vein. At this stage, even more of the aspirin will be removed through a process called first-pass metabolism. The liver's job is a bit like a filter. It will metabolize drugs before they reach the rest of the body. It does this in a few steps. Phase 1 metabolism. First, aspirin is hydrolyzed, breaking off ethanoic acid and leaving behind salicylic acid. This salicylic acid isn't water-soluble, so it can't be excreted in urine yet. Phase 2 metabolism. An ionized group is then added to the salicylic acid, forming glucuronide, which is water-soluble and can be excreted in urine. A lot less of the aspirin will continue its journey onto the rest of the body, including the site of the pain. Only 68% of orally taken aspirin will have any effect at all, because of all the filtering that the body has done. This percentage is called the drug's oral bioavailability. If drugs are not administered orally, e.g. intravenously or buccally, then they can bypass the small intestine and liver, so none of this filtering takes place, and they have 100% bioavailability. We are now at the site of some skin tissue damage. Tissues in the skin are creating prostaglandins, which are causing inflammation. The prostaglandins are sending messages to the nerves in the skin responsible for the sensation of pain. Once the aspirin arrives in the blood supply at the site, it prevents the production of prostaglandins in the tissue, which will reduce the swelling and stop the messages being sent to the nerves that are perceived as pain. Excretion. Any remaining aspirin in the blood will go round and round the blood supply, going back through the liver several times until it is all used up or filtered out of the body. It travels into the kidneys and then into the bladder for excretion.
So this is how I think now it is very clear to you that in the drug discovery, when a molecule is identified, immediately what it will go to the pharmacokinetic department, where they will work out on all possibilities of the pharmacokinetics and how it is metabolized, the metabolic products, and what is the availability and such sort of things. and other hand, it will go to the molecule, same molecule go to the toxicity department, and toxicology work will be carried out. That is acute toxicity, subacute toxicity, chronic toxicity. In the acute toxicity, LD50 will be known, and based on the LD50, a dose determination will be there. And in the subchronic toxicity, 3-dose level work will be carried out. In the chronic toxicity, 2-dose level work will be carried out. Finally, in subchronic and chronic toxicity, the possible toxic effects, if at all there, over the body will be determined. The subchronic toxicity is studied for 90 days, and chronic toxicity 2 to 7 years. The study will be continued. So in the beginning itself, the toxicity study will be carried out. In the acute toxicity, single dose on various doses on single group of animals will be given, and thereby what, in acute toxicity in 24 hours, whether it produces any toxicity effect or not. And by giving the graded dose, we will come to know the lethal dose 50. Based on the lethal dose 50, whether 1 by 100 or 1 by 1,000, depending on the potency of the molecule, a dose can be determined and toxic studies will be carried out. It gives a idea related to the dose determination and the toxic effects that are shown by the molecule, whether tolerable or intolerable. And now, drug discovery, its necessity. Do we need drug discovery? And is it necessary for us? And let us go through it. For our country, drug discovery is compulsory. Majority of our available drugs are from foreign companies. And this has not only created our dependence on foreign pharma companies, but also produce adverse effects on our economy, because we are buying them, whatever the cost that they are saying, we are buying. And in India, our population is more, naturally that consumption also will be more naturally when we are buying our economy. If we discover that particular drug, naturally our economy will increase, because we are going to send it to the outside countries. Thereby trade will be there, economy and growth or development also will be, growth also increases, GDP will increase, gross domestic purchase of the country will increase. Animal experiments, an obligation. Say it is, until now you people know that definitely animal experimentation is very essential in the program of drug discovery. On one hand, we are emphasizing the need of drugs discovery. On other, animal experimentation is being opposed. This is a glaring contradictory situation that we are facing today in India. To discover and develop a drug, experiments on efficacy and toxicity are essential. So thereby, without toxicity, without knowing the efficacy, we cannot go for clinical trials. So, and human we cannot use because it damages our. This drug discovery and development, a drug experiments on efficacy and toxicity are essential, thereby animals are an obligation. Let us know about the essentials of animal experiments for drug discovery. Importance of animals in drug discovery. There is practical జూమ్ గెట్ వచ్చేసి అయిందా? వచ్చిందా? షేర్ చేస్తా. షేర్ చేయండి. చూసుకోండి రేపు ప్రాబ్లమ్స్ ఇలా రాకుండా. షేర్ చేస్తావా? వీళ్ళందరూ నాకు అట్టు రాకూడదు.
Sir, it's visible, sir.
ఇట్ ఈస్ విజిబుల్.
Yeah, sir.
ఏంటంటే బై వన్ నేను ఎక్స్ప్లెయిన్ చేస్తుంటే రావాలి. అంటే ఎస్ ఎస్ ఓకే.
Yes, sir.
Drug discovery and development. So, in the drug discovery, first identify a disease. What is the disease? And then the pathology behind it, targets behind it. Then isolate protein and isolate protein involved in disease. And this takes some time. See here the identification, because the pathological condition, state, and the mechanism, biochemistry, everything that is to be understood first, and the targets first, they are to be known. When the targets and critical targets are known, then the drug discovery on those targets will be synthesized, and thereby what? Further promotion of drug discovery will start for all these things to get the molecule to the level of required concept, and it takes 2 to 5 years depending on the condition. And next is what? Find a drug effective against disease protein. Now after this, what in this particular period only, we are getting a molecule. Now this is the molecule, say. Then immediately preclinical testing will be there. Preclinical testing is what? On animals. For example, here guinea pig is actually shown. It is a very good model for assessing the the asthma. If it is a anti-asthmatic molecule, and on guinea pigs what? Anti-asthmatic activity will be assessed. This is one example. And when in the preclinical testing 1 to 3 years, when fruitful results are coming out and the molecule is giving a good amount of showing its good amount of efficacy in alleviating the disease condition, then scale up of that particular molecule and formulation. Now itself that molecule will be given to the scaling up and formulation development to the technology people, and thereafter the total information will be documented, preclinical testing and formulation testing and scaling up testing, whatnot, everything, and every bit will be recorded, and that will file in the form of investigational new drug, and then it will be submitted to the FDA. FDA will critically observe. It may take 1 year or 1.5 years, or sometimes it may be 2 years also. All these things critically they will examine. Then they will give for NDA, new drug application. Then human, see, after filing NDA after 30 days, then we can start human clinical trials. And human clinical trials starting from that particular area to 2 to 10 years. In a variation will be there. For example, in the COVID vaccine, see how short time they have taken for the clinical trials. Like that, a fixation depending on the interest and need, present very much need of the disease, a clinical trials will be performed, and human clinical trial will go. And human clinical trial, you know, the zero phase will be there. Phase 1, where the dosing level will be learned, and normal human volunteers in small number they are taken. And in phase 2, diseased patients from 50 to 250 or sometimes 300 also will be collected, and in disease condition, and the trials will be carried out. And in Phase 3, a large number, the same diseased persons will be taken, and on large number of large population, the work will be, clinical trials will be carried out. Here, randomized design will be there. And here the doctor as well as the patient doesn't know what type of placebo evaluation also will be carried out at this particular stage. When here it is found in the clinical trials what dose is to be given and how many times it is to be given. This sort of information in the phase 2 clinical trials, little will get. In the phase 3, a complete dose determination will be available, and the bioavailability of the compound will be available, and pharmacokinetics of the subject variation also will be available. Everything, whatever the information that is collected, and any sort of the minute adverse reaction, that will be also noticed and that will be recorded, and all files will be prepared. And if the drug is having therapeutic effect with minimal toxicity, really good. If therapeutic effect, moderate toxicity, there also it is essential, because moderate come to the normal after stopping the treatment. And if severe toxicity is there, then it may be discarded. It may be discarded, and FDA will think over on that. And now, after completion of this particular thing, phase 4 is the marketing side. This surveillance effect of drug on countless number of individuals. And here, information will be collected for a long period, because drug is marketed, and subject variations also will be there. All these things will come into picture, and it will be released into the market, and it is filed to the new drug application. Earlier, after preclinical study, that is IND, investigational new drug application, and that is submitted to the FDA. After human clinical trials, the file is submitted to the FDA as a new drug application, and now it will take some time. It may be 1 year or 7 months or 1.5 years. NDA will critically examine every point, FDA, and this new drug application approval will come by FDA afterwards, because the FDA rules are very stringent. So this is how the FDA approval they get. And for all this business to complete, what it takes a 10 to 15 years to come into the market. If it comes early, that means what, 20 years is the span, and more time will be there to the company person for marketing the drug, because he is the sole proprietor for that. And if it takes 15 years only, 5 years only will be there, the spent amount may be more, thereby the cost effect of the drug also for the public will be more. So this is how these things will work out on the cost regulation of that particular drug molecule. So no businessman without profit, they cannot do business. And this is how the drug discovery and development story takes place. And drug design, molecular modeling, virtual screening, all these things, because of the high throughputs, the time period can be shortened. Earlier, 15 years if it took, now it may take 8 to 10 years time. And thereafterwards, it may be FDA approval, it can go. Technology is impacting this particular process. That's what high throughput screening is responsible for that. It is, I am going more fast because less time is available. And overview of drug development, first stage is what? Hit and lead compound development. Whether it may be flora or fauna, hit molecule is to be developed. It may be through combinatorial at CAD or in silico modeling mechanism, whatever it may be, or it may be from say plant sources identification, and then subjected for the drug development. And this sort of things, what in the stage 1, hit and lead compounds developed first. And when that is developed, then screening on animals will be there. That is the stage 2, preclinical study. Earlier I discussed. And next is phase 3, clinical studies will be carried out. This phase 2 and phase 3 totally, that is the experimental pharmacology. And this is the way the stage 1, stage 2, stage 3, a compound in the stage 3 clinical development, the 5 compounds were observed, but regulatory approval, 1 compound may come because that is the more safest compound. So this is the story, and the money that is spent on that particular product, that one product is very high, thereby what? Sometimes if it is less amount is spent, that cost will be less, and if more amount is spent on that particular one compound, the cost will be more. Sometimes we feel that 400 per capsule, 1000 per capsule. Oh, this is the story. Now we know that till now we discussed about the development of drug discovery, and there we came to know that the animal study is inevitable for bring a drug molecule into the market. So the importance of preclinical study in drug development, it involves mainly experimentation with animals and useful in characterization of toxic profile, safety and efficacy of the drug, dose determination. All these things, the preclinical study gives characterization of practical toxicity profile, safety and efficacy of drug, dose determination. And what is an animal model? According to Wessler 1976, a living organism with an inherited, natural, acquired or induced pathological process that in one way or other way closely resembles the same phenotypes or will be also studied. Physiology, pharmacology, immunology, and structural activity relationship, physiology, biochemistry, and synthetic, and prospective molecule that is formed into a drug. So discovery importance of animal is there because in all these areas, safety assessment is the main thing. In order to assess the safety of the molecule and in order to know the mechanism of the molecule, whether it is working similarly in a diseased condition or not, animal testing is very essential. The 3 R's in animal research. An important criterion which all scientists engaged in animal research must follow this: refinement, reduction, replacement. See, they should not use because they are animal in what fashion they want to use that way of taking animal should not be there. They should be refined, and there must be a reduction. Optimal number is to be taken. And whenever any animal is during this experimental program, death is there, it is to be substituted with the same type of animal. Replacement must be there, and total number of animals should be normal at the end of the study. And what animals we use and why we use them. More than 90% of animals used for drug research, rats, mice, as they represent mammalian group, they are available through laboratory breeding facility. Only 1-2% drug research is conducted with large animals that include dogs, cats, and primates. The scientific reason behind us them are our cardiovascular system is closely similar to dogs. Understand? Our nervous system of cat resembles to that of humans. 95% of our genes are similar to apes. That means what? Lot of similarity is there. So many systems are more or less similar to our systems. And thereby what? Animals are a best model for the evaluation of drug discovery. And now classification based on that: experimental animals, vertebrates and invertebrates, and rodents, non-rodents, and others. In the others, rodents, rabbits, cats, monkey, etc. They will come. Mouse, rats, guinea pig, hamster, gerbil, they come as a rodents. And others, fish, zebra, chicken, what not, other animals will come here. See, now you people are working similarly, taking an animal rat or a mouse for your experimental study in the M.Pharm level for pharmacology students for their project. But you must be very thorough with the models, the animals that are to be used, why we have to use only this particular type of animal in order to get values accessible by the international community. This is the normal research method, what you are doing in normal laboratories. But when it when you represent your results to the international community, certain standards have to be met, and different types of animals are there for specific assessment and assay of a drug molecule. And if we use that, naturally other comments will not be there. And approximately 100 million vertebrates are experimentally around the world every year used. This is the thing. And now, rat, you see how beautiful it is. And if you see, Sprague-Dally rats are there, Wistar rats, subgroups they are, albino strain. The Wistar rats, the wide head is there and the ear is long, whereas the tail length is less than the body length. So by looking at the animal itself, we can assess whether it is a Wistar rat or Sprague-Dally rat. In the Sprague-Dally rat, longer and narrow head is there, tail is longer than the body length. Then definitely this particular rat is a Wistar rat. Don't write wrong things. When the length of the tail is long, that means what? It is a Sprague-Dally rat. When the head and the length of the tail is short than the body, then it is Wistar rat. And another point you have to note that rats do not have tonsils and gallbladder. That also you must know. Don't do experiment on them. A diffuse pancreas is there. So not a good model for type 1 diabetes. Type 2 diabetes can be assessed, but type 1 diabetes, it is not a good model. Tail of rat helps in thermoregulation of the body. That is why it moves several times, tail. Inbred strain. See, now this is dark agouti rat. The research application of this particular rat is what? Urinary bladder tumor, autoimmune disease conditions, it is a model, multiple sclerosis, collagen-induced arthritis for that model. This particular dark agouti rat is a good model and good selection also. And this is spontaneously hypertensive rat. The research application of this type of rats are what? Model for insulin resistance and essential hypertension in non-obese humans. It represents that particular population. It is for model for insulin resistance and essential hypertension. Childhood hyperkinesis and ADHD. Screening antihypertensive drugs, this model works well. And the another rat is what? Brown Norway rat. The research applications is what? Behavioral study can be carried out using this particular rat. Antidepressant, antipsychotic, or other behavioral profiles which alters, and that type of drugs can be screened. Myelocytic leukemia cancer, it is a good model. See, this mercury chloride induced nephritis, it's a good model. Cancer research, it is a model in cancer research also. Brown Norway rat. And outbird strain. And research application. Now you see, already we mentioned Wistar and Sprague-Dally rat. Wistar rats in generally a good model in teratogenicity studies and carcinogenicity studies. Liver physiology studies, that is the liver dysfunction studies can be carried out. Evaluation of anti-ulcer drugs, Wistar rat is a good model. Isolation of rat preparations like uterus, colon and ileum useful for bioassay of various neurotransmitters. So on isolated preparations, SS will be carried out for some drugs or some compounds isolated from animals, and where they cannot be assessed their biological activity, then using this bioassay on these isolated preparation, they can be assessed. Sprague Dally rat, neuroendocrine disorder studies, memory, ischemia, neurological effects of nutrients, nutrition, and induced excitatory excitotoxicity, nociception, and signaling mechanisms will be established. Long events rat research application. Preferential alcoholic embryopathy study in leukemia and breast cancer studies. These long events rat are being used. Diet-induced obesity studies, neurological research, diabetic research, behavioral research. These long events rats, when it is very much identified in other models, and taking a specific model, if we extend the study, it represents to the scientific community in a better way. And mutant rats and Jucker obese rat. You may not be seen all these type of animals which are being used in drug discovery laboratories. And today you got this particular opportunity. Research application. This important genetic model for research on obesity and hypertension. This Jucker obese rats. And nude ethnic rat research application. Most preferred model for immunological research and cancer research. This particular model. And tumor angiogenesis studies are also, it is a good model. Hereditary kidney disease, for that also, it's a good model, this nude ethnic rat. And mouse, it is in generally we use in the pharmacology laboratory for acute toxicity studies, screening of various pharmacological agents, analgesics, anti-epileptics, and teratogenic studies. And they are the smallest animals, and when the drug quantity is very minimal and the drug activity is to be assessed, in such conditions, these mouse are being taken. And guinea pig, it is, I told you, research application, evaluation of bronchodilators, immunological research, study of tuberculosis, screening of spasmodics and antispasmodic compounds using isolated preparation. This helium is a best isolated preparation for study of screening of spasmodics, antispasmodics. And hamster, this is, in this two models are there, golden hamster and Chinese hamster. And these things are used mainly used in diabetic research, used in cytogenetic research, a good model for Duncan's muscular dystrophy, dental caries, cardiac myopathy, polycystic disease, hormonal effects on reproduction, experimental tumor production. In all conditions, what is hamsters, both golden hamster and Chinese hamster are used. Gerbil, this is another model. And research animal. Research application is, it is a very good model for stroke studies. Used in lipid metabolism and heart disease studies are too. Obesity and insulin resistance studies too, it is used. Diabetic cataract and angiopathy. Vertebral degeneration study also. This Gerbil is a good model. And rabbits, we are using for many things, and time is very short. I am skipping. And this is cat. It is very good model for cardiovascular research. And nowadays, the pharmacology people in India and in many areas, they don't know how to handle with this cat to conduct cardiovascular studies. But we had the opportunity because I have taken this 1 month training in CDRA during UNESCO program. And we three, myself, Dhawan, and from Srinagar, one person selected, and majority are the from other countries. We had that program, and during that time we learned. Even this anti-malarial screening also very well we learned in CDRA. Many things we learned in CDRA. Nowadays, the pharmacology people, they don't know. Handling the cat itself is very difficult for them. Dog. This is a regular thing. It's not great, but I may conducted on say cardiovascular system, many experiments on cardiovascular system. I used my students training for the students MFOMS training and for research work. Nearly we used 350 dogs in a year in our laboratory. Mostly the Visakhapatnam municipal stray dogs, they use it to supply municipality department. And monkeys, the final model, 95% of their genes and our genes are similar, and at higher end, these animals are used. Frogs, it is for experimental study, mostly commonly used for CVS and CNS studies, for retinal toxicity of drugs. Isolated organs like rectus abdominis muscle and rectal preparations are useful in the assay of many drugs. Gerbil fish, even toxicity studies, that zebrafish using this toxicity studies can be carried out, and if a drug is having sedative or stimulant activity, by giving them we can study by mobility of the animal itself we can study, but in generally for toxicity studies this uh, zebrafish is used mostly. Pigs are also used. See, guinea pigs, it is very important for study the screening of anti-emetic activity, cardiovascular disease such as spontaneous arteriosclerosis and standardization of cardiac glycosides. And these PGNs are used. So for standardization in earlier, we standardized. What we'll do, we'll give it through a vein to the of the pigeon or guinea pig, the cardiac glycoside in a slow manner, slow injector, using slow injector. Whenever the cardiac arrest or head drop is there, death. Head drop method, for that also, detubercular assay, these things will be used. And many other purposes also, PGNs are also used. And now you have seen the many types of animals are there for different type to conduct different types of pharmacological experiments, and high-end animals you have seen. And the benefits availed due to animal experimentation is what? A medicine, Accutane and Roaccutane has been used to treat skin diseases. During animal testing, it was found to cause birth defects, and for this reason, doctors never prescribed this drug to pregnant women. See, if we do not have that information in animals, naturally, we may not be knowing that. After it becomes like another thalidomide case, because earlier they have not conducted much experiments on animals, and the thalidomide, a tranquilizer and sleep inducer that is given to the pregnant women, in generally they do not get good sleep in nights, and they have given prescribed, doctors prescribed, and later they found that this ductless babies and say teratogenic effect they notice, and say what is the thing happened, the human race affected. So if we do conduct properly every bit of observation through animal experimentation, definitely we can guess, or we can draw more attention to alleviate that particular situation by mechanism, structural alteration, or any other means. So many cytotoxic drugs developed for dealing with cancer are found to be highly toxic in animal testing. So that information, 30 to 40% of drugs are found to be unsuitable at their advanced stage of development due to potential toxicity and high risk for human life. So this clearly elucidates the importance of animal testing. I hope you all might be notice, it is very important. Animal testing is important, very important in drug discovery. Failure of drug due to insufficient animal research. I told you this already. And in myocardial infarction, heart failure caused, thereby TZD is discarded in many countries. European Medicine Agency on 23rd September 2010 recommended the suspension of the marketing authorization for the rosiglitazone, anti-diabetic, it's an anti-diabetic medicine. So failure also, drugs due to insufficient animal research program. This sort of things in the middle may happen. We lost our, another thing also, we lost our valuable natural resource product due to lack of research drive for drug from for research drive for drug discovery. See, curcumin from haldi is an excellent anti-cancer compound with which human trials have progressing at NIH. Curcumin is now a property of America. It is our product, but property of America. That is why publish perish or patent flourish. The slogan is there. If you want to perish, you publish. If you want to patent a product, you patent, not publish. Work it fully with a creative mind. Definitely you will be successful. Similarly, we will lose many others if drug discovery in our country is not given a serious attention along with the animal test facilities. Our dependence for drugs will not only cause economic loss, but also the irony of fate is our valuable natural resource material of potential drug candidates will be the property of other countries, and we will buy them paying a high price, rendering them unaffordable for many severely suffering common people of our country. So this thing we may lose if we do not think more on this particular aspect. Now I will show in short period, handling is also very important. Please you go through that. So mouse handling technique is this way. You have to hold the animal. You should not stress when you are conducting experiments. And rat handling technique. This is how you have to handle rats. And this is guinea pig handling technique. And rabbit handling technique. And routes of drug administration. This is how intraperitoneal injection. If we do not give properly, it may go to the bladder. Say if we draw the plunger, if air after inserting inside the abdomen, if air comes, then it is clear that you are in the intraperitoneal area. If any other fluid comes, then you are in a wrong position. You should not give there. It may be a bladder. And this is how the intravenous injections in animals, tail vein and ear vein of rabbit. And thigh muscle, how we have to give injection, holding the animal. Subcutaneous injection, how we have to give. Nap the neck. Intracardiac injection, how it is to be given. And general information on laboratory animals. And here it gives the weight, the range and everything. Srinivas. అదే ఇంకా అయిపోయింది, ఇది టకటక అయిపోయింది. అయితే ఆపేద్దామా జనరల్ ఇన్ఫర్మేషన్. వైటల్ పారామీటర్స్ దే ఆర్ ఆల్ ఇంపార్టెంట్. వాళ్ళు అట్లీస్ట్ మీ దాంట్లో రికార్డ్ అవుతుంది, ఇలా పెట్టేస్తున్నాను, తర్వాత చూసింది. వేరియబిలిటీ కూడా అందు గురించే, డోస్ డిటర్మినేషన్ క్యాలిక్యులేషన్ కూడా ఇస్తున్నారు అనమాట. సబ్ క్రానిక్ టాక్సిటీ స్టడీస్ కూడాను, స్పెషల్ టెస్ట్లు, ల్యాబొరేటరీవి నేను విజిట్ చేసినవి, కొన్ని యానిమల్ మోడల్స్ ఎలా ఉంటాయి ఏమిటి, ఇండస్ట్రియల్ ఇది ఎలా ఉంటుంది ఏమిటి, అదంతా అయిపోయింది. రైట్ రైట్ సి ఓకే 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 ఓకే. ఇంకా నెక్స్ట్ టైం ఉండదు అబ్బాయి, ప్లానింగ్ అనేది ప్రాపర్గా ఉండాలి. ఓకే 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 ఓకే. ఎస్ నౌ ఐ పుట్ ద డెడికేటెడ్. ఐ థింక్ మీ దాంట్లో యూట్యూబ్లో అవన్నీ ఫాస్ట్గా వెళ్ళిపోయి ఉంటాయి. నేను ఇప్పుడు అన్ని చేసి థ్యాంక్స్ దట్ వచ్చాను. ఓకే, ఐ థ్యాంక్ ద Vigyan College of Pharmacy for giving me this opportunity to enlighten the students and to create some sort of interest in the drug discovery and development. So you have seen and you understood, I hope, and this is how in the drug discovery and development program carried out, and so many specializations will involve in the process of developing a new drug. Efforts will be there. Hope you people now think in a positive direction and give good presentation through your way of doing things. Wish you all the luck. Thank you. Thank you, Srinivas. My talk is over. 5 minutes left over.
Thanks, sir. And it's a very good extensive lecture, sir. And I hope all the students will be benefited on this research. On behalf of Vignan Pharmacy, we thanks our beloved Guru Rajeswar Rao Garu for giving excellent session to all the participants, and this will be given as YouTube recording to all the students of the juniors and all in the future. So on behalf of that, we want to give a certificate of appreciation, sir. So please hand over to the Dr. Ravi Shankar, HOD of the Department of Pharmaceutical Analysis.
Hello.
Shankar.
Sir, Professor Dr. Rajeshwara, sir, your topic that you have delivered was just awesome, sir. In fact, your presentation is educational, thought-provoking. In fact, that is just phenomenal. You know, your skills are just exploding. You have explained all the things that are explicable way that you could understand well. Okay. Okay. Now, on behalf of Vignan Pharmacy College and all of you, it is our honor to present Professor Dr. Rajeshwara Garu, Principal of Lydia College of Pharmacy, with this explicit virtual certificate of appreciation. Okay, sir. So awesome, sir.
Oh, thank you.
Thank you so much, sir.
The session is over.
No, okay, sir. Over, sir.
Okay, then I will close.
And before,
Okay, sir.
thank you, sir.
Sir, 1 minute.
Okay.
Hello, Ashok.
Sir.
We are on time. Only 2 minutes are there for 1:30.
Okay, right, sir.
Very nice, sir. And I congratulate the organizing secretary Ashok and HOD Dr. Ravi Shankar and all the team members. And especially, we are very much thankful to the Dr. Rajeswar Rao sir for helping us and guiding us doing this session excellently. And all these 6 days, sir has given a very nice input. And in future, we will do the best, sir. Whatever some technical problems, please regret us. And this will try for next time. We won't happen. It won't happen in the next future sessions. Thank you, sir. Thank you very much.
Okay, thank you, Rajeshwara, sir.
Thank you. Thank you.
Thank you,
Thank
sir.
you.
So nice and kind of you, sir. Right.
Thank you.
Okay, bye, sir. Bye for now.
Bye. Bye.